Hi, guys. My name is Abby Meyers, and I am proudly presenting my final DNP presentation over the development of a clinical practice guideline on pain interventions for intramuscular or IM injections in pediatric patients. I couldn't have done this project without my DNP chair, Dr. Maria Snell, nurses 705, Dr. Jennifer Brunworth, and of course, my community member, Cassandra Clemens. So this CPG project was very unique as it didn't involve human participants and relied solely on stakeholders for analysis. Developing the CPG consisted of evidence based recommendations from a comprehensive literature review, like I said before, and that literature review was those four main items that I talked about before. But it really emphasized on two main themes, which was different pain interventions for specific groups and increasing the awareness about IM injections in various aspects to healthcare professionals and the caregivers. Creating the CPG provided recommendations to healthcare professionals with a main strong focus in registered nurses because those are the ones who mainly administer these injections, and also allow standardization of care to all pediatric patients who receive these injections. This guideline was developed between fall 2023 and fall 2024. And then after completion, I presented the CPG with other materials prior to the agreed to tool completion. And this included the clinical practice guideline with the one-page quick reference table, a short YouTube video explaining the tool, the agreed to tool reviewer manual, a short PowerPoint presentation regarding the overall project, and then a frequently asked questions email with all things that stakeholders should know. I also talk about, what that tool was as well. And I will talk about the GRE2 tool more in depth in later parts of this presentation. The setting of the scholarly project took place in an inpatient floor specializing in infectious diseases at a local children's hospital in Columbus, Ohio. And there was various inclusion criteria and exclusion criteria, but inclusion criteria was the individual had to be at least 18 years or older. They also had to work or were a part of the administration process for pediatric patients who receive IM injections. They also needed to work on the inpatient floor where the project took place. And then they also needed to be at least an NCH employee for 90 days. They couldn't be on orientation. For recruitment, stakeholders received an email and followed up in person through like a face-to-face contact through me. They were also explained the purpose of the guideline, the instrument utilized to evaluate the guideline, and then the feedback needed to after completion of like the guideline overlook. The inclusion and exclusion process continued until at least, but preferably 15 expected stakeholders were identified, and I ended up getting 16, and that were willing to complete the tool. So, like I said before, the scholarly project was a non-interventional project because it involved stakeholders instead of human subjects. So, I had 14 stakeholders adequately complete the tool, and it consisted of one clinical manager, one clinical educator, one clinical leader, four physicians, which one was a resident and three were attendings, one advanced practice registered nurse, 5 registered nurses with various experience, and then 1 certified child life specialist. So since domain 3 was the most questions asked when doing the data analysis, that's how I made my threshold, which was the recommendation of the Greek 2 tool, as there was 4 different recommendations that you could use to create your threshold, and that's the one I picked and determined a threshold from there. So my threshold was over 80, equal or 80 to percent. So my range was from 64.1%, which was domain 6, to the highest was domain 1 at 95.2%. So domain 1, 2, 3, and 4 did not need modification, but domains 5, applicability, and domain 6, editorial independence, did. And so when modifying this CPG, I used the qualitative results or the feedback to kind of guide me into that modification. And some of the qualitative results I got was it does not state the stakeholders' names in the development of this clinical practice guideline. It did not highlight or rank recommendation in order from first to last line. It did need to add intervals for pain assessments for monitoring, auditing. So kind of saying is, the score mild, moderate, severe. I also needed to integrate the cost of the potential resources for recommendations, such as the Buzzy, since we didn't have that on the inpatient floor that I was currently, or that I implemented this project on. Elements of the funding body was not found, and then adding a disclaimer about competing interest. Since I did not get funding and I didn't have any competing interest, but that was domain 6, specifically, so definitely needed to add those in there since I was below that threshold. Other things was, those 2 additional items, and I had the average of the first one of overall recommendation was a 6.07, which was really great, with 67% recommending the guideline with yes, with no modifications, and then 33% or 4 stakeholders recommending yes, but with modifications. So when modifying domain 5 and 6, I used the qualitative results, but I also used the grade method, which I used primarily in my table that I showed you before to kind of grade the evidence. But I used grade when looking at it more, I used the grade to use specific language to explain what first line, second line was to make the CPG standardized. So, like I said, I did modifications to domain 5 and 6 because it fell below that threshold. And so, what I did is I used that qualitative feedback and I used the grade method, or the grading of recommendation, assessment, development, and evaluation method, to kind of revise that 1 page quick reference table that I showed before in this presentation, to explain the first line, the second line, and then third line of what research kind of displayed. But I also made sure that all the recommendations were very uniformed and standardized with the grade method. So that helped a lot. Another thing I also did was I helped modify the part before the table, which was in the translation to practice. And this just explained when I would revise the tool if it got adopted into practice, also how much things could cost, and that, such as Buzzy, and that there was no competing interest in this CPG, as it was only done by me, and stakeholders had no conflicting interest. So once I did that, I presented the CPG yet again to my clinical manager on that floor, and adoption was granted in February of 2025, which was awesome. And so this is hopefully going to show that integrating pain interventions can increase patient satisfaction, compliance, and increase nurse and caregiver education while decreasing pain and negative emotional states.